Regarding this budget, I agree with everything that has been said. I just want to make a very few points. I appreciated the council's support for language that we added, Mr. Rice and I offered, that will provide accountability over time for our efforts to address the academic achievement and opportunity gap in the school system. This fall, the school system was already working on, and our budget enshrines that the school system will provide easy-to-follow data indicators, including things like graduation rates and test scores, that will enable us to track trends over time, because these very large investments above maintenance of effort that we're making are intended to ensure that no matter where a student lives in this county, no matter what language that student's family speaks at home, no matter what that student's economic background, an education in Montgomery County Public Schools should be a superb opportunity for success in the future. And we want to make sure that every Montgomery County student has that same opportunity, and with these data indicators over time, will be accountable for the results of our investments in this area. In the Health and Human Services Committee, it's been the greatest honor of my life to have served as chairman of that committee for the last 15 years, and we've continued our progress in this year's budget in ensuring that every resident of Montgomery County is able to see a doctor, regardless of economic status, regardless of insurance coverage. I was pleased for the years following the enactment of the Affordable Care Act that we were actually able to spend less each year on Montgomery Cares, because more and more of our residents were getting coverage through the exchanges or through expanded Medicaid. Indeed, 40,000 Montgomery County residents depend upon Obamacare for their health coverage. That coverage is at risk. The Republican Congress intends to dismantle it, and unfortunately, the demands upon the Montgomery Cares network of community clinics are going to grow. I don't believe we're going to be able to maintain the downward trend in spending on that program, and indeed this year we've added resources substantially to meet that need, and I very much appreciate the support of my colleagues for that critically important initiative, which benefits everyone in the county. If you don't get your care at a clinic, you're going to get your care in the emergency room. That is the most expensive and least efficient way to get care, and we all pay. And we've got to continue reminding people of that as the demand for our resources increases. And if the Republican Congress and President Trump are successful, more and more people lose coverage. I'm also absolutely delighted that we made a strong commitment to house our chronically homeless population, which, as in the case of primary health care, saves money. When you have an individual living in the woods, living on the streets, drawing down emergency room care, frequently ending up incarcerated, study after study has shown that it is less expensive for the public sector to provide housing for those individuals than it is to meet their needs when they are living in the rough and sleeping in the rough. And so we will launch this year the Inside Not Outside campaign that draws substantially on federal housing vouchers. Fortunately, those housing vouchers were not cut in the continuing resolution that passed the Congress, but if President Trump's budget had prevailed, there would have been a dramatic rise in chronic homelessness, and in fact the elimination proposed in President Trump's budget of the Interagency Council on Homelessness. That is just not cost effective, and I do hope, and of course it's morally shocking, and I do hope that we will be successful in our effort to address the needs of every chronically homeless individual in the county. I'm extremely pleased that this year, and the county executive has been very supportive of this, and this council added resources for a supervised visitation center for families who have experienced domestic violence. There are cases in which spouses who have abused their spouses still have visitation rights and custody rights, or weekend visitation rights, that kind of thing, with their children, but when the exchange occurs, it places the abused spouse at risk. We're providing a facility that will ensure that those exchanges occur safely, and I think we should all be really proud of that. I think that's a tremendous accomplishment. I do want to say very briefly regarding the grants process. There's been excellent discussion here, and I know there will be further discussion about trying to consolidate the grants made in the executive branch with the grants made at the county council. I don't think the current county executive would be favorable to that approach, so I think it's a conversation that's going to have to continue beyond 2018, but it just doesn't make sense to put our nonprofit service providers with their limited budgets and the need to put their resources into direct services to people in need through the hoop-jumping exercise in 2 different branches of county government that they go through. Having said that, I want to say to grantees, we know the funds that the county executive recommends, so that when a grantee comes to us and says, we're not getting anything in this budget, and we can look at the county executive's list and see that the county executive is recommending county funds for that grantee, that's not a very persuasive case. So people say, you haven't given us anything after the Grants Advisory Group made very difficult recommendations at the council end. We have a very complex process where community volunteers devote their time to go through in great detail the merits of the different grant applications, and of necessity, that Grants Advisory Group sometimes says no. It's very difficult in Montgomery County government to say no. In fact, I do think that the ability to say no is a skill that we ought to work on a little more. I think we're very good at very many things. I really do, and I think this budget is an excellent document that meets a lot of needs. I do think we need to work on our ability to say no. The county executive provides a lot of grants, and when the Grants Advisory Group does not fund something and a grantee comes to us and says we're not getting anything, and that entity is funded on the county executive's list, we're aware of it. So it just isn't persuasive for a grantee to come and say we didn't get anything when the county executive actually made a recommendation. They're all county dollars, and as far as we're concerned, we're actually funding the county executive's recommendations. I do think that the entire process would benefit from unified scrutiny. I cannot today say with confidence that 100% of the grants recommended by the county executive are 100% things that I would support. But we've given discretion, and as a courtesy to the county executive, we've funded all of his recommendations. I will say that with less than half as much money, the county council's grants process gets more than twice as much scrutiny. So I'll yield, and I thank my colleagues. I thank the council president. I do think that we've done good work here, and I do think this is an excellent product.